The WellSouth Primary Health Network is helping more people in Otago and Southland quit smoking than ever before. The latest Ministry of Health results for the region have just been released, and the Services Manager Kaylene Holland joins us to explain. Good evening.
Good evening, Rebecca.
What data does the Ministry record?
The number of patients at our practices that are smokers and have been offered help to quit in the quarter that they're collecting the data for.
How has the southern region improved?
By just constantly following up with patients and supporting practices with resources and other IT tools, texting services so that they can contact patients that they know are smokers to check that they are still smokers, and offering referral into services for help to quit.
Tell us about the national targets for quitting smoking.
Okay, there's 5 health targets. One of them is around the smoking target, so also there's cervical screening, immunisation and cardiovascular, more heart and diabetes checks. So the smoking target is that patients that are known to be smokers aged between 15 years and 74 years are offered help to quit at least once a year.
What sort of assistance do they get?
They can get medication, referred to some of the community providers that provide ongoing, more counselling type support. Patches, gum, just whatever is they identify as the best way will help them to quit smoking.
How many smokers do we think we have in Otago and Southland?
We've got just on 34,000 smokers across the district. Obviously the majority of them are in Otago, but the percentage equivalent to the population is higher in Southland, so it's around 20%, whereas in Otago it's 14–15%.
What are some of the challenges in getting them to quit?
I think it takes around, for some people, up to 20 quit attempts before they finally quit the habit, so it's maintaining the engagement with them. You know, they worry that the next time they're going to fall off the ladder. Trying to provide services across a really wide geographical area, and just keeping patients engaged around it, and support and motivation for clinicians to keep following up with patients.
Has the skyrocketing cost of a packet of cigarettes really had the effect that was hoped for?
Yeah, well, we hope so. There's certainly a lot of evidence to suggest that increasing the cost of smoking, and certainly young people, they're quite price sensitive, so the hope is that fewer of them are likely to take up smoking because of the cost.
What are the plans to improve the targets going forward?
Just to keep doing what we're doing. It's like I say, patients have to be contacted every year if they're a smoker, so it's going to be constant to keep on top of that target, and not every patient comes into the practice every year, so we've got to find innovative, creative ways of catching up with patients to get them, to offer them help to quit. What
is WellSouth's ultimate goal in regards to smokers?
We support the Ministry's target of New Zealand being smoke-free by 2025. Obviously, fewer smokers means better health for everyone. And reducing the number of smokers and reducing the number of young people that are taking up smoking by health promoting activities.
Was there anything in the budget for smoking or reducing smoking?
Not specifically around that. I mean, there's money being put into health, and I'm sure some of that will end up being used to fund cessation programs.
Is it getting easier for people to stop smoking?
It's still one of the most addictive habits around, so I wouldn't say it's easier. There's a lot more options available to support, and we try and make sure that they're available where patients are across the district.
Well done on the results. Keep up the great work. WellSouth Primary Health Network Service Manager Kaylene Holland, thanks very much for your time.
Thanks, Rebecca.